In an emergency, minutes count.
The argument to approve an ambulance tax has been circulating on social media for weeks.
Within 4 minutes, and that proved enough to restart his heart.
When you dial 911, you'll usually hear from one of these people inside the Emergency Control Center at Heartland Regional Medical Center.
There's a call that'll come up here, like those were over there.
It's a service with some of the fastest response times in the country. But it's also one Heartland says it simply can't afford anymore. Last April, the hospital announced they could no longer sustain ambulance services, citing a $1.7 million annual shortfall because of the Affordable Care Act. It created a significant decrease in reimbursement from the federal government for health care. That 1.7 loss is expected to increase even further.
The Obamacare was signed and became law in 2010. When that happened, the hospital industry was assigned $155 billion in cuts over a 10-year period. So those cuts are now hitting hospitals across the country. And so we knew at that point we needed to start looking for efficiencies within the system.
That announcement sent the county scrambling. R.T. Turner is the Buchanan County presiding commissioner.
Yeah, we've been in negotiations with Heartland. We've had some conversations with them now, and we've kind of at a point that we need to find out if this is going to move forward or not.
So the county formed a committee, the CARE Committee. And when the chair, Scott Meyerhofer, first heard the news, his first thought was,
wow, didn't see that coming. They had given such, exceptional service and quality up until that point. And I guess the real reaction was, why? And I really didn't know at that point.
But Heartland's chief strategy officer says it's something they've been looking at since 2010.
Our board's been pretty clear to us that we want to be collaborative with the city and the county, so we're open to what ideas they have on the best way to implement all this.
That committee spent months looking at several different options, including a private contractor coming in to establish their own base. The county insists the option on the ballot is the cheapest and most effective.
What we're looking at is leasing the equipment from Heartland, at least the first year, and then we will capitalize each year as new ambulances come on, and we will purchase those ambulances and they will become our equipment over a period of probably 3 or 4 years.
We had third-party, for-profit people come in and say, if they ran this without a subsidy, they would be there would be about a 38%, a minimum of 38% increase in cost and a 50% increase in response times.
But the solution they came up with depends on your vote. It's a quarter-cent sales tax. It would generate $2.7 million for the county to form a regional emergency management service authority. Board members would be elected by the community and would help facilitate the process.
Because what we do not want anybody to see is a diminishing in services of what they have now.
The second part of that plan would involve leasing those employees to the county. Salaries and benefits of the workers would remain the same, and the county would pay Heartland, at least for now, as a temporary service. There's not much comparison for a plan like this. There aren't dense enough populations surrounding St. Joseph to tell if a regional ambulance service would or would not work. The biggest opposition to this tax increase appears to be coming from a political action committee in Platte County called Freedom PAC. They're no stranger to Northwest Missouri politics, especially if a tax increase is either directly on the ballot or linked to a candidate running for office. They got involved in the Savannah mayoral elections back in April, and they urged the ouster of then-Mayor Dave Ingersoll. Their efforts worked. We reached out to Freedom PAC for a comment or even a request for interview, and they haven't returned our calls.
I will tell you, and this is not a threat by any means, but the county or the city, neither one have an obligation to provide an ambulance service. We took the lead on this because we care about this community, want to provide a good service.
And viewers have also told us in the last few days, robocalls have gone out discouraging people from approving this tax. But supporters say the public service is vital.
Nobody likes taxes. Fortunately, a quarter cent, which most people don't realize, is actually only a quarter for every $100. So if you're going to go out and buy $100 worth of groceries for your family, most people are willing to pay a quarter to have this type of quality ambulance service. It's such a must for the community.
Greg Miller, Fox 26, KNPN.